at the inner eyebrow, we can access the infratrochlear and supratrochlear nerve. This is part of the trigeminal nerve, which is cranial nerve 5. So yesterday I did a lot of practice for this tutorial on the left side of my face, and it's actually lifted and more relaxed and open than the right side of my face right now. So I'm going to primarily work on the right side of my face today. So we have here, if you look, I'm not pressing into that inner canthus of, within the soft part of the eye at all. I'm going to press up towards the bone, the upper orbital of the eye. And so we're basically going to hold a point here that might feel a little tender, or you might feel a tiny little click of going across a tiny little bump. And that is actually the supratrochlear nerve. So this is an acupuncture point called Bright Eyes. It's meant to actually clear the eye, relax the eye, and also clear our vision internally, mental vision. So here we are relaxing this component and pressing up under the muscle of the eyebrow. This is an area, instead of, pinching between our brows, which often feels like we're releasing good tension, when we're getting these deep lines between our eyebrows like that. That can help, but this is actually a more focused, effective way to massage that area. You can do it on both sides. You can try different directions of circling. And then we're going to feel our way under the eyebrow. We want to basically reach, we're on top of the bone, underneath the muscle, right at that border. And so now, if you want to be fancy and use 2 of these, you can actually pinch your eyebrow like this. Feels really good. Whoop. So that's a technique I love using on patients in clinic. And it takes a little bit of coordination. This is a good exercise for your non-dominant hand also. It's kind of like dancing. You've got to use both sides of your body. And that's one reason it helps promote resilience in your brain. So I recommend trying to use both hands on this type of treatment. But for simplicity's sake, today we're going to mainly focus on one at a time. And coming up to the center of the eyebrow, this is an important point. We can actually follow straight up the forehead to another point, gallbladder 14. This is also accessing part of the supraorbital nerve, part of the trigeminal nerve. The trigeminal nerve is in charge of the sensation of the face and also chewing, the muscles of mastication. That's one reason it's so important for jaw tension. This is a lovely point to work on forehead lines, actually. This also helps with eye tension, and it can also help with this kind of the side of the forehead becoming tight. So it's a little bit, it's adjacent to the temple, which we'll get to soon. But we can start here. Oftentimes this can be tender when you have sinus pain as well, or tension. Now, come back to here. Just working on the eyebrow itself can actually do a lot of good for the forehead and eye. Now we're coming over to the auriculotemporal nerve here. So I like following the arch of the eye, and then basically we're coming across the bone to the outside of the supraorbital, the upper eye orbital. And this is outside the bone towards the temple. Now we're going up into the hairline, and clench your jaw to make sure you're on the muscle that's activated when you clench your jaw. So that is. And now we're going to massage that muscle gently. And this is coming into the facial nerve, which is cranial nerve 7. This is a temporal branch. And the facial nerve is in charge of the muscles of expression as well as taste. So the trigeminal nerve and facial nerve overlap. One's more involved in sense. One is more involved in movement. And they both feed and impact each other. So when we're working in this area, we're really stimulating the facial nerve and helping to reset some of those muscles that become clamped down. I often find that when the temporal muscle becomes really tight, it squinches our face, it kind of narrows our face. It's not only the eyebrow muscles, it's the temporal muscle that really cause this feeling of restriction and narrowing to happen. So when we're working on opening up the expression of the face, relaxing and softening our eyes, this is a really important point to work on. Because the fascia of the whole side of our head and neck is impacted by the mask loops around here, or even just by more compression around the back of the head, this also makes it even more important. So you can massage in circles. You can use your fingers to flick back, or you can use the broad side of a tool to flick and aim. I aim over the curve of the ear. So we can actually just follow the curve of the ear back down to the occipital line here. When you reach the base of your skull, then you can start flicking upward. So you can actually gain more traction at those suboccipital muscles right here. So we want to follow all the way from the temple back down to this area about 1 to 2 inches behind the ear. And that area also is important for vision. In Chinese medicine, it's a very big point for helping with clearing the head. Gallbladder 20, or the wind pool. And there's another point that's about 1 inch to 1 centimeter behind the ear that is helpful for encouraging sleep and relaxation. It's actually been, it's called Anmian, and it's studied as part of a self-acupressure routine that was just published recently in a protocol used on breast cancer survivors who have significant fatigue. Fatigue as well as anxiety or depression and insomnia. So this point actually really can help with relieving symptoms of insomnia and depression and anxiety, as well as helping reduce fatigue, probably by allowing for a deeper sleep. And this point was actually used in combination with this point right in between the eyes, which doesn't necessarily connect with a nerve directly, but this is one of the most famous points in Chinese medicine for soothing the nervous system. It's often one that acupuncturists will use to close people's eyes. It just feels like it's creating this kind of heavy-lidded sensation when you just thread an acupuncture needle this way. But you can also stimulate it by pressure. And this study, which I'll quote below, also showed distinctive impacts in the brain, in different regions of the brain, just using acupressure. So it's a really important study that's showing that different acupuncture points, just using acupressure, will actually stimulate different parts of the brain. So something that we've been using, that facial massage therapists and people practicing traditional East Asian medicine have been taking advantage of for thousands of years, but now we're actually elucidating the physiological connections in the brain. So now all that is to say, we're starting to relax, starting to soothe our hopefully we're actually soothing our sympathetic nervous system, which is the fight, flight, and freeze system. But more importantly, we're stimulating the parasympathetic nervous system, which is rest and digest. So once we're working on this area, oftentimes if my jaw is really, really tight, if I use gua sha or even massaging with my knuckles in this area between my lateral eyebrow and the temple, it starts to impact this part of my face and help loosen it, because we're impacting connective tissue here that is woven into this area. So you can see if I just lift this part of my skin, it's moving this whole area, and that actually sends signals to muscles underneath as well. So we're coming up here, working on this spot. It's a very important spot to reach, because if you just keep pressing on your jaw and pressing on your jaw, it might cause even more of a headache because this area is stuck. Before I go down into the jaw again, lastly, there is a set of points in the hairline, about within the first ½ inch of the hairline. See, it's hard to, okay, where are they going to meet? All right, come on, brain. All right, good. So anyway, we have points in the first ½ inch of the hairline that actually work together to stimulate rest. So what you can do at home is, even just using your fingers, find areas that might feel tight, tender, like a tiny little bump, or even just like a little bit sore, and create little circles in that area. Or more effectively, you can kind of iron them out with a tool. And oftentimes you can feel different parts of your body relaxing. Often I will work on this front part in order to relax part of the back of my neck. This whole center line of the scalp can actually treat a lot of disorders along the spine. And then there's a correlation to the motor and sensory neuron cortex along the sides of the front of the scalp, which is used in post-stroke rehabilitation, as well as some other neurological rehab stuff. So there's a lot more research behind that, but what we are going to work on today is actually just in the hairline, because that's the fastest way to relax a lot of the connective tissue that's impacting the tightening down of the forehead and the tightening down of the back of the neck. So when you're using acupuncture in this point, there's a point protocol called the sleep tiara, colloquially by American practitioners. That is just it's a set of acupuncture points that comes out of the hairline like a little tiara. So I think of that when I'm doing acupressure at home. And now we're going to go down to the front of the ear, and this is an area that is a super dense area in terms of nerves. So this is something you have to be very careful with, because there's also big veins that come down through this area. Of course, there's a jugular and there's the carotid artery underneath the SCM here. There's also some more superficial veins in this area that if you're doing cupping, for example, at home, you don't want to use strong cupping in this area, even though it might feel good, because we don't want to create or move a blood clot. So gentle gua sha in this area is the most safe, along with acupressure and massage, for helping to relieve that type of tension. So when we come up to the front here, we are looking at the mandibular branch of the trigeminal nerve, and then the zygomatic branch of the facial nerve, basically kind of overlapping in this area. So there's a point that if you press gently upward from your jaw muscle up, you'll bump into the archway of your cheekbone here. And you want to find this little hole that is accessed when your jaw is at rest. Now, when your jaw is really open, it's going to pop out. So you're in the right place when you know that if you open your jaw, it pops out. So this area is going to help with not only the sensory feelings, but also the muscle movement in this area. So we want to do little circles in this area to start massaging the masseter muscle here. And this is something that, if it's been tight for a long time, it might feel like as hard as a board of wood. Or if it's not super tight, but there could be a lot of puffiness because the connective tissue is stuck, it might feel like swampy or soggy or puffy. And so this is an area that a lot of different sensations can be felt when we're massaging this area. And either way, our goal is to help relax some of the connective tissue, create a soothing input on the superficial component of the skin with very, very gentle strokes mixed in with more direct acupressure. So I like using a combination of kind of a still point, holding pressure, and then tiny little circles, not rubbing the surface of the skin in a circle, but holding and providing this kind of wiggle in a circle. And then doing gentle strokes. You can do that with your finger. You can do that brushing. This is something that's basically like caressing a baby's face or caressing the face of a loved one, and you can be your own loved one. So this is really good. Now we're coming down to we're going to follow the border here down the marginal mandibular nerve branch of the facial nerve. Again, coming down around the side here, you're going to help with the actual motor muscle kind of stimulus of the jaw. And this might feel crunchy. So this is actually an area that can evolve some connective tissue anchoring points around the muscle onto the bone. And when we move those, it helps pop open some of the pathways through which fluid may more easily move. And then anytime we're working on this area that's close to the earlobe, I like to come over here and just really gently brush downward to stimulate. This is basically the opening point through which the part of the trigeminal and facial nerves come out to cross the face. So right under the earlobe is where the trunk kind of emerges, and we're not trying to dig into that. We're just trying to create a very gentle stimulus on the superficial component of the skin here. This is an area, there's a reason I think why people would put an essential oil that's soothing right behind the ear. It's not necessarily because it's warm. There's other parts of your body that are warmer, like your armpits. But this is an area which has potentially a big impact on your nervous system. So if we put a soothing oil there, and it's stimulating our mind to relax, and then we're also using this brushing movement at the same time, that's a really powerful way to soothe, to self-soothe. And then, of course, it's related to pulling down on your earlobe, which is an automatic reaction that babies have for self-soothing. And so, there's no placebo effect there. This is something that I know that my second daughter did in utero. She was pulling on her ear in utero anytime she was tense. And she still did that when she was a really little baby. So there's that coming down. And people will talk about lymphatic drainage in this area. The goal of this treatment is not lymphatic drainage necessarily. That might be a side effect of it, of helping to relax some of the connective tissue. But this is not a lymphatic drainage massage by any means. That's a totally separate technique. Okay, so now we're coming along the jaw, and we want to come up to there's a foramen or an opening here called the mentalis. Well, mentalis is a chin. Mental foramen. You know, this mentum thinking. We're mentating. Actually, there's a relation to this kind of fear and the chin. And so if we're overthinking, over worrying, and there's fear associated with it, our chin might get really tight. It's kind of fascinating component of facial diagnosis that I learned from Lillian Bridges, who's an expert in the field of Chinese facial reading. So often I come up, if there's been a lot of fear happening, which I think just nationally there is fear everywhere now, it's worthwhile to spend some time on our chin to relax. There can be a hidden area of stress here that might be impacting our jaw too. So the mental nerve is part of the trigeminal nerve, the sensory nerve, and you can sometimes really stimulate it and feel a little zing here. This is something that we want to just gently stimulate with pressure and then gentle smoothing movement. And now, as you're coming from the center of the chin back to the jaw again, you're going to hit a wall if you're pressing in a little bit. And this wall is, again, the masseter, that huge muscle comes straight down like this. So what we're going to do is basically angle into the front edge and press in there and do little circles. And then we're going to come up to where it really makes this little V here with the cheekbone and the masseter. So we've got the cheekbone here, masseter here, and we want to come right in front of there at this conjoining point between the muscle and the bone and press diagonally up into there. This is a point that is used to lift the face. So it's trying to help basically reactivate the positive muscle memory of when our facial muscles are all springy and loose and full of blood and fluid when we were younger. And what we were trying to do is actually get back to that state of the face when we were younger, obviously, in which our muscles were more relaxed. So when we think of relaxation and like, oh, is that going to make my face droopy? No, relaxation is really going to help fill your muscles with blood and create a blood pump to help flush your face with nutrients. So as we get older, our muscles get tighter. They become more dehydrated along with our skin. And so in order to create the fluidity and nourishment in our face, we need to help facial muscles relax. And this is one productive area to help that happen. And so this is coming into the buccal, the cheek nerve, the facial branch of the facial nerve, and then the zygomatic branch here. And then the last component we want to do is we're actually going to come up into the front here. So now that we've really found the cheekbone here, we want to follow underneath it up to the front, right under, looking straight ahead, the pupil line. You can use that as a reference. And usually, unless you have like a perfect diet and perfect sleep and no inflammation in your body, usually there's a little bit of puffiness here. And this is something that is often related to digestive systems on the stomach channel. This is an important point here because it's actually right over a hole in the cheekbone called the infraorbital foramen, and the infraorbital nerve branch of the trigeminal nerve comes right out of it. It's a sensory nerve, and it is something that you can really feel when you're pressing in this area. It should feel like a little crunchy bit. And so what you want to do, instead of doing big circles here, actually. I always when I'm working on the face, I always think about going upward and outward. So we kind of want to angle this direction, upward, outward. So we're coming up this way. And this area can help relieve congestion in the nose. And again, there can be a backlog of lymphatic fluid here too, and inflammation that can also be contributing to jaw tension. So here, this component is actually helping to stimulate the movement of that fluid under the cheek. We want to help it come out around the ear. And this one I found actually to be, if you're able to hold this point for a minute, for some reason it's incredibly soothing. Oftentimes, if I come to this part of a facial massage, people will just go deep into la la land. They'll zonk right out if I'm pressing this point for a long time. And I don't know why that is compared to other parts of the face. I would think that would be this point, but for some reason, this one actually does it more frequently. And you can actually work on this whole line here. When you just have a smooth surface like this, you're not dragging the skin, it's fine to just move along this way. If you have hydrated, if your skin has been moisturized, that's not dry and it's not dragging, you can just do this kind of movement and find areas all along underneath your cheekbone that might feel stuck or tense or puffy. And follow it all the way back. Come to the top of the ear here. This is another acupressure point that is incredibly productive to massage for relaxing the whole face and for a face lifting effect. So basically a centimeter above this part of the ear, kind of in line, usually in line with the top of the ear, in the hairline, within a centimeter. And you should feel it moving a lot of tissue right around the side of your scalp. And now you can follow it again back down the back of the ear to Anmian. Soothing, soothing, soothing. And come down under the earlobe, gently sweeping. Gently sweeping. Now comes the neck. But that's another video, because if you just work on the face and even the scalp, but you don't work on the neck, it could potentially cause more neck tension because you're stimulating relaxation here when oftentimes some of the tension in our face, or a lot of the tension in our face, comes from a neck tension or imbalance. And if that's still there, it's going to pop right back up into your face, but it might hurt more before it does. So next up is neck mobility and neck massage. So thank you for listening to this journey through the side of the face. I'll also post one that you can follow along for both sides of the face without me jabbering on the whole time. So you can just follow the actual routine directly. But I hope this is helpful in explaining some of the reasons why we're using specific points of the face. And they really overlap directly with so many really important acupressure points. And it's just a wonderful window into the power of self-care, self-massage, self-touch, and self-soothing that we can really take advantage of. This can be done even when you're so tired that you can't get out of bed. You could just sit there. You don't even have to look at your face when you're doing it. You can feel it out. So I would highly recommend exploring the parts of your face that feel good to massage or tender. And if anything is painful, don't press there. There's a difference between tender, like feeling like, oh, that's a spot that is a little bit sore, compared to, wow, I don't want to press that anymore because it hurts. If you have that response, it's just follow that. Do not press harder. It's not the case that pressing harder will accomplish more. It's not like deep tissue massage. The face is really, really tender, and all of the muscles actually attach onto the skin rather than onto a bone. So you have access directly to the muscle with quite a gentle touch. So simple reminder, more is not always better, and we want to continue to have a sense of gentleness and acceptance of ourselves and support for ourselves when we are working on the face. It's a very easy area to criticize, and just keep coming back to the idea of you don't have to have positive self-talk about it if you're not ready for that, but just a gentle approach is what I recommend. So thank you again, and continue following me for more of these detailed analysis tutorials in the overlap between health and beauty. Thank you.